a liquid form of fat in the blood, but the production 80% of cholesterol is produced by our liver. If it happens in the heart attack comes, and if it happens in the brain, the stroke comes. Hello, welcome back. The topic today is about cholesterol. So definitely all the patients, they would have known, my doctor told me that I have a cholesterol, so he prescribed me some tablets, and he asked, some people say, he asked me to check whether I have a cholesterol and all. So cholesterol, what is that cholesterol? Cholesterol is nothing but, to understand simply, we can say a liquid form of fat in the blood. It's not like that, but to understand simply, we can say liquid form of fat in the blood. So is it really that bad? No. The actually cholesterol is produced by our liver. Our own body is the one which produces the cholesterol. The diet wise, the cholesterol is only 20 percentage, but the production 80% of cholesterol is produced by our liver. So is it really bad one? No, but it can turn into bad cholesterol. So what is the function of the cholesterol? See, our body is made up of so many trillions of cells. Each cell wall is made up of cholesterol. The wall structure is made up of cholesterol. Your hormones is made up of cholesterol. And if there is some injury in the blood vessels, the first and foremost thing to go and bridge that damage is the cholesterol. So cholesterol has so many good functions. So it's not bad, but it can turn into bad when. So usually when doctor asks for a cholesterol test like lipid profile, a profile means there will be 4 5 subcategories of values. So the total cholesterol should be less than 200, and the LDL or the bad cholesterol or low density lipid should be less than 100. The good cholesterol or HDL, high density lipid, should be more than 40 50, and triglycerides should be less than 150. So this is the usual thing. So if it increases, are we really need to get panic? No, but if it increases, the chances of getting blood vessel injuries, like what happens when the cholesterol, when it increases, it deposits in the blood vessels. When it deposits, the lumen or the size of the blood vessels shrink, so the blood flow is obstructed. The same way, suppose the blood cholesterol increases, the blood becomes more thick. So thick blood and less lumen, so the passage is obstructed, so the damage can happen. So it can happen mostly the heart. If it happens in the heart attack comes, and if it happens in the brain, the stroke comes. So blood vessel in disease happens because of the bad cholesterol. And if it is combined with, like suppose your age over 40 years, smoking, alcohol, sedentary lifestyle, and no exercise, no healthy diet, sugar, a high sugar diet, all these things, obesity, all these things, multiplies the side effects of the cholesterol. So cholesterol comes under the metabolic syndrome, where like diabetes, thyroid, obesity, hypertension, all these things are syndrome. So this cholesterol adds up to the metabolic syndrome, and it can affect the heart and brain. So what to do? Again, as I told you, our liver is the one which produces the cholesterol. So how to reduce the cholesterol? First, probably it all depends upon your age and other parameters, like diabetes, thyroid, all these things. The doctor sometimes will prescribe the medicine, but it can happen to like for other reasons. First and foremost is a lifestyle, sedentary lifestyle, sitting job, no physical activity, no exercise. That is the first thing. Number two, smoking, alcohol. Alcohol intake increases the cholesterol level, and obesity. Obesity increases the cholesterol level. Sometimes it can happen because of the genetics. It runs in family, the family, familial. So where certain enzymes are deficient, so that produces more cholesterol. So whatever it is, if it's a high cholesterol, it needs some attention. Like first is lifestyle. So do regular exercise, minimum 45 minutes of walking, and healthy food like fruits, vegetables. This is very important. Fiber rich diet, this is very very important. Avoid complete sugar, carbohydrate diet, that is also very important. And oil, when it comes to oil, you know when we reuse again and again the same oil, that it becomes trans fat. So reusing the oil also has to be cut down. So avoid fried items. All these things very important. And people talk about ghee is good, cheese is good. No, very simple. Whether it's a trans fat or saturated fat. These two, if it's a trans fat and saturated fat, it is bad. So look for trans fat and saturated fat in any, the oily things, the cheese, mayonnaise, ghee. If it is there, it's a bad one. When young age, nothing, because they'll be physically active or maybe they're growing, probably is used for that. But after 18, 20 years, then it slowly adds up and becomes a bad one. So uh, good sleep is very important, because and yearly food, that is very very important. When the dinner is very late, the late, the more cholesterol production. Your liver is the one which produces the cholesterol, especially in the night time. So yearly food, simple food, steam cooked food, all the very good. And of course exercise, and look for other reasons for the metabolic syndrome, diabetes, hypertension, thyroid. So these things has to be taken care. And if your cholesterol is persistently high, especially the LDL, and you are more prone for cardiac disease because of the family history or smoking, alcohol, or even obesity, and doctor, they usually give the statin tablets. And most of the time the tablet has to be taken lifelong, most of the time. And people take medicine for 1 month, 2 months, it will come down, and they think they'll stop. No, as long as you are taking the medicine, probably the cholesterol level is low. Once you stop, after a few days or few months, it will rise again. So unless your doctor says, don't change or don't stop the medicine. Thank you.